My name is Trina Markham, and I am a student of Counseling 5813 Test and Measurements. The following is my final project case presentation. My client's name is AR. She is a 31-year-old separated white female who has worked as a receptionist for the last 8 months. She's been separated from her husband since 2015, and she has 2 children, 2 boys. One is a son that lives with her, and the other son lives with the father. AR presents with concerns of her feelings of sadness, hopelessness, and worthlessness. She complains of tiredness and thoughts of dying. AR would like to focus on her feelings of sadness, for she feels she will never feel happiness again. She explains she has even lost interest in participating in activities with her children that once brought her joy. At this point, we discussed my status as a student, and the names of my university supervisor and employee were given to her. She signed the informed consent, and we further discussed issues of confidentiality and procedures for any after-hours emergencies. The client does not appear to be in crisis at this time. She denied any current thoughts or feelings related to self-harm, although there is a history of a suicide attempt in 2001. There are no reporting responsibilities present. She has some support within the transition house where she resides. AR voiced a preference for a female therapist such as myself. I foresee no issues that would impede the therapeutic relationship. AR loves her children and her current job. She has recently enrolled in college where she maintains an AB average. However, she worries that her problems and issues will soon affect her schoolwork. And she states that she feels extremely sad almost daily, and she doesn't enjoy activities such as school or even the activities with her children or friends. She reports crying for no reason, tiredness, increased appetite, and weight gain. She worries her sadness will soon affect her performance at work as well. She is oriented to place, time, and person. Thinking is linear and her memory is good. Affect matches content. She denies any current suicidal or homicidal ideations or actions. She denies use of alcohol or drugs and is drug tested at the transition house where she resides. She has some support, which includes the other families at the transition housing program. AR has yet to attribute her changes in mood as directly related to any particular source. Her predominant mood is described as sadness, but she also complains about crying and feeling worthless. She's been experiencing problematic symptoms for 2 to 4 weeks, thus ruling out a chronic or persistent problem. My provisional diagnosis at this time is 296.22 major depressive disorder, single episode moderate, as defined by the DSM-5. Given the information that I have thus far, I feel this diagnosis warranted and will later be justified by the interpretation of assessment instruments, the MCMI and the MMPI that was administered. Also, the mental status examination was given to AR. The treatment plan that I have designed for AR is as follows. Since the patient is not acutely suicidal at present and is not psychotic, she does not currently meet criteria for hospitalization. Therefore, I will attempt to treat her as an outpatient. However, I will refer for possible pharmacological evaluation, and I also plan to use a cognitive behavioral therapy model for treatment, with the goals of therapy to be to reduce her dysfunctional behaviors, reduce negative distorted thinking, increase her feelings of self-worth, self-value, and self-image. These goals can be achieved through individual counseling, group counseling, and I also plan to include client homework. Prognosis is good for the client as indicated by previous completions of treatment. She's in good physical health. She has a good level of motivation, and she has very forthcoming behaviors. Goals and interventions. First problem identified is, of course, the depressed mood. Goal is to alleviate depressive symptoms and return to previous level of effective functioning, with objective to be, one, to be client will cooperate with a medical psychiatric evaluation for medication needs, any possible medication needs. The intervention will be a client referral either to a medical doctor or a psychiatrist that the client will attend to determine if medication is needed to stabilize her symptoms. Objective 2 will be client will describe distorted thinking. Intervention, client will identify 3 thoughts that are distorted, such as everyone will reject me, and she will process the underlying defective schema with the therapist at our next session. This comes from the cognitive behavioral therapy model. The third intervention, attend group psychoeducational sessions to inform of the nature, cause, and treatment of depression. The intervention to be client will verbalize at least 3 facts learned concerning the nature and cause of depression, and will practice at least 1 new skill learned during session to aid treatment. This theory, of course, is CBT. The next problem identified was low self-esteem. The goal here will be to talk about underlying feelings of guilt, fears of rejection, dependency, or abandonment that she may have, with objective to be aid client in differentiating between real and imagined losses, rejections, and abandonments. Intervention, client will maintain a thought record for 1 week. She will record 3 situations in 3 different manners. She will write about the cognitions preceding the situation, the actual situation, and the emotional reaction immediately following the situation. And then at our following session, we will go over her thought record, and she will process collaboratively with me concerning what she had written. This comes from the cognitive behavioral theory. Number 2, reduce avoidance and uncomfortableness in social situations. Intervention, the therapist and client will role play so the client can learn at least 2 new social skills and practice in session with myself in a safe environment her new social skills. This would come from the cognitive behavioral therapy model. And number 3, increase positive self-talk. Intervention would be another homework assignment. I love homework assignments. The client will write 1 hopeful positive statement per week and practice this statement in the mirror every morning. And this, of course, this is another CBT. And that is all that I have for you today. Thank you.